Right. So, again, magandang umaga po sa lahat and Happy New Year, no? Sa inyo. Sana kumpleto pa rin yung kamay nyo, 10 pa rin ha. Sana walang nawala dyan kahit isa. So first, I would like to thank the SHIP Academy through the leadership, of course, of Dr. Kate Laritana for inviting the Department of Health Epidemiology Bureau in the 5th HIV Telehealth Training Program, no? Today, I will be discussing the Philippine HIV epidemic, focused in understanding the history and epidemiology of the HIV in the country. No, ano lang hindi ko madidiscuss yung history talaga ng HIV kung saan siya nagsimula, 1980s or something, no. But I will be discussing the history of HIV surveillance in the country, no, yung pagko-collect natin ng data and the milestone of the surveillance system in the country. Okay. Ngayon, what will be our learning objectives, no? So at the end of the lecture, I hope that participants should be able to understand the key terms and concepts used in the monitoring of the magnitude and progression of the HIV in the Philippines. And of course, have an overview of the global burden of HIV and understand the HIV epidemiology in the Philippines. Very timely yung yung nag-interview kayo ng people, no, para kasi lumalabas talaga na hindi pa ganoon kalakas yung ating advocacy on HIV. Hindi pa rin talaga masyadong alam ng mga tao in terms of yung HIV, no? Not only in the country, sa Philippines, but ibang bansa pa rin siguro. And yung mga poll questions is tamang-tama din sa discussion ko, no? So maintindihan nila kung ano yung sitwasyon ng HIV sa Pilipinas. So my topic will be, one is the very basic of the HIV, no? And second is the national HIV/AIDS and STI surveillance in the Philippines. And I will be discussing, of course, the key concepts of the HIV surveillance, the HIV epidemic in the Philippines, of course, the 95-95-95 HIV care cascade, the accomplishments, and what are the gaps na kailangan pa natin tugunan, no, para ma-achieve natin yung targets na to. First, why do healthcare workers need to know about HIV? When HIV first discovered, no, there was no effective treatment and many people died from AIDS-related diseases before they reached older age, no? That all changed in the mid-1990s with the discovery of effective medication. Now, if someone is diagnosed on time and receives the treatment, they can expect to have a normal expectancy, di ba? If you aren't completely up to date about HIV, you won't be alone, no? Hindi kayo nag-iisa. Research shows that the general public as a whole are confused about how the virus is passed on. And even some GPs and healthcare professionals have a poor understanding of it, no? So let's discuss the very basic, no, of the HIV/AIDS and what is the difference between the two. How it is transmitted, facts of HIV, and etc. And I think majority naman ng ating participants ngayon ay alam ito. Pero this is a very quick lang, no, to refresh your mind lang before proceeding the HIV situation. All right, so HIV is a virus, no, that attacks and damages the body's immune system. It makes the body's immune system less effective over time so that it can no longer protect itself against diseases which it would normally be able to fight off. As the virus destroys and impairs the function of immune cells, infected individuals, no, gradually become immunodeficient. So immune function is typically measured by CD4 cell count. I think this will be discussed by the second speaker, no. People who are undiagnosed and have been living with HIV for a considerable time can develop a serious illness or ito yung tinatawag na opportunistic infection such as yung pneumonia, yung TB, and certain types of cancer. So eventually, HIV may lead to acquired immunodeficiency syndrome. So AIDS is a condition with a set of symptoms occurring at the same time, or dito yung syndrome, no? In a person with HIV when he or she or his or her immune system is weak and the body can no longer defend itself and fight off common opportunistic infections. So AIDS can lead to unnecessary death if not treated. HIV can be found and therefore it can be transmitted through what? Body fluids such as yung blood, semen, vaginal fluids, and breast milk. No? So what are the 4 conditions for HIV to be transmitted? So may condition pang HIV ano bago makapasok sa isang tao, no? So exit. So HIV must exit the body of a person with HIV. Dapat mayroon siyang enough amount of virus sa kanyang pagpasok, no? And HIV must be in right conditions to survive. Yung factors dito is include yung outside of the body, yung temperature natin, etc. So the last is HIV must enter the bloodstream of another person to infect. So these are the 4 conditions bago siya makapasok sa katawan ng isang tao. So what are the 4 modes of HIV transmission? Isa ito sa, I think, sa na survey nyo, no? So basically, HIV is transmitted through penetrative anal or vaginal sex between mother and also yung between mother and infant during the pregnancy, childbirth and breastfeeding, through sharing of contaminated needles, in healthcare settings, and drug infections and blood transfusion. So HIV is not transmitted very efficiently, so the risk of infection, so I mean doon sa single act of vaginal sex is low, no? But ito yung yung mataas yung probability na ma-infect ka is yung through anal sex. So through anal sex has been reported be 10 times higher than vaginal sex, no? A person with an untreated sexually transmitted infection, particularly involving ulcers or discharge, is on average is 6 to 10 times more likely to pass on acquired HIV during sex. Oral sex is regarded as a low-risk sexual activity in terms of HIV transmission. When a person living with HIV is taking effective antiretroviral therapy and a suppressed viral load, they are no longer infectious, no? In terms of mother-child transmission, HIV can be transmitted to an infant during pregnancy, labor, or during delivery and breastfeeding. Generally, there is a 15 to 30% risk of transmission from mother to child before and during delivery. A number of factors influence the risk of infection, particularly the viral load of the mother at birth. The higher the load, the higher the risk. No? Transmission from mother to child after birth can also occur during breastfeeding, but the chances of transmission of HIV to a child is very low if the mother is on antiretroviral therapy during pregnancy and when breastfeeding. Transmission through the sharing of needles naman and syringes, reusing or sharing needles or syringes represents a highly efficient way of transmitting HIV. The risk of transmission can be lowered substantially among people who inject drugs by always using new needles and syringes that are disposable or by properly sterilizing reusable needles or syringes before reuse. No? Transmission in a healthcare setting can be lowered by healthcare workers adhering to universal precautions. Diba? Tandaan natin yung universal precautions na yan sa healthcare setting. The last is transmission through the blood transfusion. There is a high risk or greater than 90% of acquiring HIV through the transfusion of infected blood and blood products. However, the implementation of blood safety standards ensures the provision of safe, adequate, and good quality blood and blood products for all patients, no, requiring transfusion. So very strict dyan ang ating mga blood banks, no. Blood safety includes in screening of all donated blood for HIV and other blood-borne pathogens as well as appropriate donor selection. Okay. So HIV cannot be transmitted through what? There's no evidence that the virus is spread through these common misconceptions, no? Yung using or swimming in a pool, mosquito bite, kissing, hugging, holding hands, sharing utensils or eating together, coughing, use of toilet bowls or sweat. So ito yung hindi talaga natatransmit. Wala pang evidence na natransmit siya sa isang tao. Now, you may ask, is there a cure for HIV? The answer is there is none. However, there's a treatment for HIV. Although usually used interchangeably, no, it's important to note the difference between the two. Cure is a complete or permanent solution of remedy. Meanwhile, treatment is a substance or technique used to care for an illness or deal with it medically or surgically, which may not be a permanent solution. So, ano example dito? Best example dito na may isang disease na hindi siya nagagamot pero namamanage siya dahil meron siyang iniinom na gamot. Like yung diabetes is the best example on this, no? Pero ma-maintain mo siya pero hindi siya nawawala. So, ganun din sa HIV. Let's go to the antiretroviral medicines or ART or antiretroviral therapy. These are used in the treatment of HIV infection, but not a cure for HIV. They work against HIV infections by blocking the reproduction of HIV in the body. That's why antiretroviral therapy or ART is started promptly and taken regularly. It results in quality and length of life for someone living with HIV that is similar, so that expect in the absence of infections. Through what? The test early and treat all policy, limitations on ART initiation is aimed to be removed, no, by this policy, ensuring all PHIV in the country have access to free antiretroviral therapy. When a person living with HIV is on effective antiretroviral therapy, they are no longer infectious, thus reducing the risk of HIV transmission. Ito po yung tinatawag natin na U equals U or undetectable equals untransmissible. Now, let's discuss the HIV/AIDS and STI surveillance system in the Philippines. How robust our surveillance system in terms of tracking the HIV care cascade, no, sa Pilipinas. So before delving into the situation of HIV epidemic in the Philippines, let us look back on how the current surveillance system was continuously developed and enhanced through the years. In 1984, when the first diagnosed HIV case in the Philippines was reported, actually, hindi siya local. Ito po ay isang galing siya sa ibang bansa na umuwi ng Pilipinas. Ang first AIDS case natin. Okay. So, in 1987, the HIV registry was established with the goals of 1, logging all confirmed HIV positive cases. 2 is to analyze the profiles of the HIV. And the 3, monitoring the progression of the disease. No? In 1998 naman, ay na-establish yung Comprehensive HIV/AIDS Monitoring Program or tinatawag na AIDS Watch. Ito yung ating batas noong RA 8504 na passed and signed noong 1998. And in 2005, wait, kunin ko yung laser pointer na. And in 2005, yung serologic and behavioral surveillance were merged into integrated HIV behavioral and surveillance system, no, IHBSS. Ito yung ginagawa ng Department of Health para makita kung gaano kataas yung prevalence and also the behavior of the key populations natin, no. Ginagawa namin ito every 3 to 4 years. In 2011, no, yung STI etiologic surveillance system collect STI reports from all social hygiene clinics, laboratory blood or labs, laboratory and blood banks, surveillance from all private and public facilities, no? And in 2005, yung antiretroviral therapy surveillance included in the HIV/AIDS and AIDS registry of the Philippines, no? Dati registry lang siya, pero ngayon hindi lang siya registry, but pinasok na rin po dito yung ART, no? And in 2018, 2017 pala, nagkaroon tayo ng pilot noong installation noong major NHSS database, no? Dahil pinasok na yung ARV, yung ART natin sa HARP, no? In 2018, when the RA-04 na repeal, na naipasa ang bagong batas, tinatawag na RA-11166, no? 2020, na-develop yung One HIV/AIDS and STI Information System para ma-improve yung current system ng EB para maipasok na yung full cascade or yung from diagnosis until doon sa mortality, no? Mailagay na siya not only for the patients monitoring, but parang EMR na itong ating report, no? O itong ating system na nakaka-capture natin sa different facilities gumagawa ng HIV testing. Also including dito yung mga treatment hubs natin. And in 2021, no, na roll out si Oasis, at the same time na-establish naman yung pre-exposure prophylaxis surveillance at yung community and facility-based screening, no? All right. So, implementing new surveillances has not been easy, no? Step-by-step process of conducting assessment and consultations, orientations, trainings, capacity building, dissemination, cascading, and providing them with technical support and guidance so that they may be able to report properly, timely, and complete. So, issuance of guidelines, the department memorandum, the administrative order, which may help them further understand the rationale, the purpose, and the how had also been helpful. Guided by the policies related to the Department of Health EB function to gather, process, and analyze data related to HIV and AIDS and STI, our office maintains several surveillance systems to keep with its mandate, no? In order for us to fulfill our mandate, we develop surveillance system with approaches, no, intended to define the different facets of the HIV and AIDS and STI epidemic in the Philippines. As exhibited, no, in the figure, there are several subsystems within the national HIV, AIDS, and STI surveillance system, and involves two types of notification, no, the passive, no, and active surveillance. This is the passive, and this is the active surveillance, no. Passive surveillance is exhibited primarily by the HARP, or the HIV/AIDS and AIDS Registry of the Philippines, and STI surveillance, wherein data is gathered by the unit through passive notification or reporting by surveillance sites or units, no? Yung treatment hubs, yung social hygiene clinics natin, yung ating HIV testing laboratories, and other testing facilities, and also including dito yung ating RESU. The HARP is a case-based surveillance that follows appeal HIV through the cascade of care from diagnosis to treatment and mortality. Recently, we have also initiated the surveillance on prevention and outreach, no? Ito yun. Exhibited by the CFBS and PrEP surveillance. Similarly, the STI surveillance system is also captures facility level and person level data on testing, detection, reactivity of different STIs, included ay yung STI etiologic surveillance system, laboratory and blood bank surveillance, EGAS, or yung enhanced gonococcal antimicrobial surveillance program. We also have a separate surveillance on viral hepatitis, including hepatitis B and C. On the other hand, the active arm of surveillance system illustrated by the IHBSS, PHAV estimates and capsize estimates, impacts, involves initiative of the unit in collecting, generating data, and involves a series of analysis, consultative meetings, and workshops with technical experts and partners and stakeholders. Since it is impossible to count the exact number of people living with HIV, people who are newly infected with HIV or people who have died from AIDS-related causes, estimates are modeled in their place. The slide shows the difference between modeled estimates and reported HIV/AIDS ART register of the Philippines. Estimated people living with HIV refer to the estimated number of people who have HIV and are currently alive for the specified year. It is different from the number of reported cases in the HARP because those are 1, diagnosed cases, and 2, cumulative counts of reported cases since the start of the HIV registry in 1984. Since there are PHIV who have not yet been diagnosed and enrolled to treatment, the estimated number of PHIV will not yet equal to the reported number of diagnosed cases. Okay? While the new infections naman refer to the estimated number of people newly infected with HIV for the specified year. Annual new infections or HIV infections are different from newly diagnosed cases reported in the HARP because newly diagnosed cases are not necessarily new infections. So yun difference ng estimated and yung ating actual cases na nare-report. For the key populations, defined as groups who, due to specific higher risk behaviors, are at risk for HIV, irrespective of the epidemic, type, or local context. Also, they often have legal and social issues related to their behaviors that increase their vulnerability to HIV. While the vulnerable populations or groups are groups of people who are particularly vulnerable to HIV infection in certain situations or contexts. So the following are the key populations or the vulnerable populations. Men having sex with men, transgender women, sex workers, and people in prostitution, people who inject drugs or use drugs, young key populations, migrant workers, and women and children. So ito yung ating key populations and yung vulnerable groups, Now let's take a glimpse of situation of the global HIV epidemic. We know that the HIV epidemic is one of the public health concern across the globe. Based on the data globally in 2021, there were 38.4 million PHIV, and 1.5 million newly infected with HIV. 650,000 of them have died from AIDS-related illnesses. But what's good to hear is that with all the interventions and efforts of different countries in place, we have already seen 32% decrease in annual new infections between 2010 to 2021. That means that looking at a global scale, we are already seeing a decreasing trend in new infection. However, looking into the HIV trend in the Philippines, this was not the case, There were 21,400 newly infected with HIV in 2021, which is a 327% increase from 2010 to 2021. Similarly, an increasing trend in diagnosed cases has also been observed and reported in the HIV/AIDS and AIDS register of the Philippines, wherein as of November of 2022, we already have recorded 108,400 diagnosed cases. Moreover, newly diagnosed cases per day had been increasing, from 9 daily cases in 2012 to 42 cases in 2022. Okay. The Philippine HIV epidemic remains concentrated among the key populations who are at high risk for HIV. In 2022, majority or 92% of new infections are coming or among the key populations, including males having sex with males, transgender women, female sex workers, and people who inject drugs. And the new infections are projected to continuously increase in the next years. With this, if current efforts in HIV response is maintained, tuloy-tuloy pa rin, parang as status quo tayo, na maintain natin yung response natin, the estimated HIV in the Philippines could reach to 364,000 by 2030, which is a twofold increase from estimated HIV by the end of 2022. We should note that the year 2030 is the time when AIDS have been ended globally based on the UN targets. Looking into the trend of new infections, nearly half of the new infections are coming from the youth, 15 to 24 years old. Yung ating nakikita na increasing ng HIV sa Pilipinas. As of November of 2022, there are a total of 108,428 diagnosed HIV cases in the country. Only 3 in 50 diagnosed HIV cases are females, and more than half of all diagnosed cases between 20 to 29 years old. Similarly, among diagnosed cases in HARP, the most predominant mode of HIV transmission is reported as of November 2022 was sexual contact. Particularly male-to-male sex, which is 56%. And then sex with both males and females, which is 27%. And male-to-female sex, which is 15%. Other modes of transmission were also reported, such as yung sharing infected needles, among PWID, which is 2%, mother-to-child transmissions, 1%, and then yung blood products and needle prick injury ay nasa 1%. Ngayon, tingnan naman natin po yung geographically ang cases natin. The regions with the most number of cases of newly reported cases remain to be yung NCR, ng Calabar Zone, yung Region 3, Region 7, and Region 6. These regions comprise of 73% of the total cases in this period. To further contextualize why HIV cases in the country are rapidly increasing, particularly among the key populations and the youth, we need to have an in-depth understanding of the risk and behavior of our key populations. One factor which contributes to the increasing cases in our country is that among our key populations, practice of risky behavior starts early. It starts early, while protective behavior start late. Okay. Data from the 2018 Integrated HIV Behavioral Surveillance show that the men having sex with men or transgender women are engaging in their first sex at age of 16, and have their first anal sex at the age of 17. However, protective behavior such as condom use starts 2 years, 2 years after their first anal sex. So this gap put them at risk for various STI, including HIV. In HIV, studies, may study na sinasabi na the longer the lag between the first condom use at first sex daw, the less likely it is for them to use condoms consistently. Okay. Moreover, their first test comes much later, or 4 years after their first anal sex. This gives us a smaller window of opportunity for early diagnosis and get them into treatment. And among those who get diagnosed with HIV and starts treatment on ART, it's usually around 28 to 29 years old. No? In addition, the level of knowledge of MSM and transgender women regarding HIV prevention, transmission, and availability of services is low. Based on the findings of the 2018 IHBSS, only 1 in 3 or 32% have correct knowledge on the 5 basic facts of HIV prevention and transmission. Okay. 53% were aware of the social hygiene clinic and their city, and back in 2018, less than 10% were aware of one of the prevention strategies, which is PrEP. No? However, it should be noted that PrEP has not yet been publicly introduced during that time. No? Unlike now, medyo na-introduce na si PrEP, kaya medyo mataas na yung awareness nila on PrEP. Further, looking into knowledge and awareness by age group, it is lowest among young MSM and TG, or transgender women, particularly the minors 15 to 17 years old, no? This is also reflected in the 2021 Young Adult Fertility and Sexuality Study, or YAPS, wherein it was noted that among the general population, only about 1 in 5 young Filipinos has comprehensive knowledge on HIV. Napakababa, napakaliit, no? Equipping RKP with the proper knowledge on HIV prevention, transmission, and availability of services would help them make more informed decisions, especially when it comes to protecting themselves. No? Moreover, the 2018 IHBSS data also showed that about 38% of MSM and transgender women did not use condom during their last anal sex. And consistent condom use was even lower at 13%. Less than half, or 47%, had access to condoms and had ever been tested for HIV. Further, lower proportion, or 1 in 3, were tested for HIV in the past 12 months. Looking into age group, no, disaggregation, still these are lowest among young MSM, no? Lowest pa rin yung young MSM and TGW, especially minors. This goes to show how vulnerable our young key populations are. And these are especially critical to address or take action on knowing that half of our new HIV infections will be coming from these populations. The interplay of several factors in terms of the behavior, knowledge, awareness, and access to HIV services interventions contribute to the increasing HIV cases in the Philippines. In addition to the risk and behaviors of the key populations, another factor which contributes to the increasing HIV cases in the country is that not all PHIV are getting tested. Accessing life-saving treatment or antiretroviral therapy and are virally suppressed, as can be demonstrated in HIV care cascade model. Further, it is important to note that the Philippine HIV epidemic was not spared of the impact of the COVID-19 pandemic, no? HIV services were disrupted from prevention, testing, and treatment, resulting to increased infections. To further understand why our country continues to observe an increasing trend of HIV cases and why reversing the HIV epidemic remains to be a challenge for the country, so let us focus our lens on the HIV care cascade model. We know that the HIV epidemic in the Philippines continue to be concentrated among key vulnerable populations. As mentioned kanina, yung men having sex with men, transgender women, female sex workers, people who inject drugs, young key populations, women and children. On the other hand, for the key population, vulnerable populations who are infected, no, with HIV, we need to test and diagnose them as early as possible. Early detection means higher chance of linking them to care before any other opportunistic infections take place, no? Bago pa ito tuluyang bumagsak ang immune system nila, it can also aid in preventing the increase of AIDS-related deaths, no? Diagnosis is one of getting them into treatment is another. Even though there is no cure for HIV at the moment, it is treatable by taking ARV, no, medications or antiretroviral therapy. So among diagnosed PLHIV, they must be enrolled to life-saving treatment, no. Among those enrolled to treatment, we have to make sure that they continuously take their ARVs and are retained, of course, on treatment. This life-saving treatment can help suppress the virus in the body and have a healthy and strong immune system. Individuals who are virally suppressed are highly unlikely to pass HIV on to others. With this, PLHIV can continue living his or her life as a normal and healthy person. These two parts of the model, it is important that we address the barriers to access the services and ensure an enabling environment for KP, PLHIV, and service providers. However, we all know that this ideal situation is not always happening. The Philippine HIV epidemic continues to expand because not all key and vulnerable populations have access to preventive services and or practicing protective behavior. Not all PLHIV are diagnosed, and not all diagnosed PLHIV are on life-saving ART. For the HIV care cascade by the end of 2022, there were 158,000 estimated PLHIV. Among those estimated PLHIV, 102,000 were diagnosed as of November of 2022. Among those diagnosed, 85,000 were enrolled to treatment, and 66,000 are currently on ART. Further, among the PLHIV and ART, 16,000 were virally suppressed. However, if we look further into the cascade, we can see that gaps exist and PLHIV get lost in care from diagnosis to treatment, retention, and viral suppression. There are 56,200 PLHIV who are not yet diagnosed, no? Among those diagnosed cases, 16,000 are yet to be enrolled to treatment. And among those who were enrolled to treatment, 18,000 were lost to follow-up and were currently not on ART as of the reporting period. These gaps bring the total of PLHIV not on ART to 91,700. The leakages along the cascade, if left unaddressed, may continue to contribute to the ongoing HIV transmission among the key vulnerable and populations, which will account for 25,100 new HIV infections in 2023 and be added to the pool of PLHIV. To understand how we can fast-track our response, let us further look into each gap in the HIV care cascade. First, prevention. PrEP, or pre-exposure prophylaxis, when HIV-negative people take HIV medicine daily or on occasion to reduce the chances of HIV infection. It is not a vaccine po, ang PrEP. And PrEP, however, does not protect people from other STIs. No? Kaya kailangan may combination ng condom use, no? When you use PrEP. PrEP is one of the combination prevention strategies that had been recently implemented and currently being strengthened in the country. PrEP is the use of antiretroviral therapy by people who have high-risk behaviors to prevent contracting HIV, no? Or ARV yung ginagamit for PrEP, no? As of October of 2022, there had already been 11,000 clients enrolled to PrEP across the 66 sites, which exceeded the HIV health sector plan of 10,000 by end of 2022. However, it should be noted that this represents only less than 23% of the non-reactive clients among PrEP facilities. This means that there are still about 75% non-reactive clients who were not enrolled to PrEP. While this represents a large gap, we acknowledge the current limitations that we have in PrEP implementation. So far, supply of PrEP had been limited at the start of the implementation. Moreover, some issues in PrEP enrollment also exist, such as clients being ineligible for PrEP, and the price of baseline labs for PrEP. Looking into the profile of our clients, no, who had been enrolled to PrEP, 1 in 3 clients enrolled to PrEP are from the 25 to 29 age group. And 70% of PrEP clients were enrolled in NCR. 94% of PrEP clients are MSM and transgender women. Prevention of new infections among key populations is one thing. Another important component is preventing new infections among babies born to pregnant women living with HIV. Looking into the care cascade among pregnant women, the ideal situation is that women living with HIV should be on life-saving treatment and virally suppressed during pregnancy. The baby should be given preventive ART and monitored and tested to be negative for HIV. However, looking into the PMTCT care cascade, although no infants were tested for positive for HIV in the past 3 years, if we look closely into each pillar, we see leakages. 1 out of 5 reported pregnant women living with HIV did not take ART. 20% of infants born from a woman living with HIV did not receive preventive ART. And 1 out of 10 infants born from women living with HIV were not tested for HIV. These gaps, which exist a cascade, although no infants were tested for HIV in the past 3 years, we have to strengthen the surveillance for the PMTCT kasi ito din yung parang gap ng surveillance namin to improve, para may strengthen siya, para makuha talaga yung true picture ng PMTCT. So, limitations on the PMT surveillance should be noted, as I mentioned, to reflect yung ating nakakaptured at nare-report. Given this, we recognize that there could be infections transmitted from mother to child that are not reflected in the cascade, kasi yung ating limitations. These gaps which exist in cascade in the reporting may be reflected with observed of mother to child transmission cases among children less than 5 years old in the past 5 years. Now, for the diagnosis, the first 95%, the demographic profile of diagnosed HIV cases in the Philippines has changed over time. Nag-change over time. Looking at the age that diagnosed HIV cases are getting younger, from 1992 to 2009, 6 in 10 diagnosed HIV cases were below 35 years old. And from 2010, in 2022, 8 in 10 were below 35 years old. Looking at the sex at birth, we have noted a change in the ratio of female to male diagnosed of HIV cases. In the early years from 1984 to 1990, 6 in 10 diagnosed HIV cases in the country were female. And from 1991, it increased to 3 in 10 and further dropped to 4 in 100 since in 2007. Majority kasi nung 1990s more on female, yung ating nakaka-captured. Kasi ito yung mga mataas ang number of cases among the sex workers pa on that time, So consequently, looking at the mode of transmission among reported diagnosed HIV cases in the country, sexual contact between males and females was the predominant mode of transmission from 1984 to 2006. And this shift to sexual contact between males having sex with males as a predominant mode of transmission, and this was evident from 2007 and remained as such as of November of 2022. Bigla siya nag-shift noong 2007 and nakita namin, na-observe namin na tumaas siya in 2007 yung males. As of November of 2022, there is still 56,200 PHIV to be diagnosed. And looking into our diagnosed trend, we can see how the COVID-19 pandemic has been one of the challenges that we had. However, we must take caution on data interpretation. Increase in diagnosis this year could mean two things, no? This could be cases that were not diagnosed in COVID and only diagnosed now, during COVID and only diagnosed now, or on the brighter side, could be due to expansion of testing case finding, no? Kasi dumadami na din yung ating mga testing facilities. While we are seeing an increasing trend, we should not be complacent, no? As looking on the left graph, dito, left graph sa side ko, there are still about 60,000, no? PHIV that are to be diagnosed. One of the efforts strategies that we have in place in terms of expanding diagnosis is the RIVDA implementation, or the Rapid HIV Diagnostic Algorithm implementation, or the centralization of the confirmatory testing. Since in June 2020, 63%, no, ay may total confirmed client na confirmed client, no? And higher treatment initiation was observed also among these clients, no? Looking into linkage to care, we can see that a relatively higher proportion had been enrolled to treatment among PHIV diagnosed through RIVDA versus centrally confirmed, no? With RIVDA, there's shorter turnaround time for confirmatory results, especially those outside NCR, no? And we know that RIVDA sites are also treatment hubs, so which may facilitate linkage to care faster and more efficiently. Okay? Ito yun. Dan Sakel. So, moving on to treatment, the second 95%, in terms of treatment enrollment among newly diagnosed cases, HARP data shows that year-end treatment enrollment has been increasing. While we still have 1 month left for the year, na ba ito? Kasi November kasi itong data. Highest rate was also observed, and this could further increase if we are able to increase enrollment both among previously diagnosed for the year and those to be diagnosed in the next month. However, zooming into the treatment gap, there are still 16,600 diagnosed with HIV that we are yet to enroll. No? Further looking into the treatment enrollment, vary by key population in age group, and was noted to be lowest among male people who inject drugs and those aged 50 and above. Focusing, the percentages in the graph represent the proportion of diagnosed cases which had been successfully enrolled by KP. No? Ito yun. And by current age group. Ito yun, current age group. Focusing on the treatment gap, this gives us an idea on who we should target to enroll to treatment, and also understand why they are not getting linked to care and what can do to address these challenges. No? Enrollment is one thing, but retaining PHIV on ART is another. No? Looking at the treatment coverage trend, we can see the proportion of diagnosed PHIV retained on treatment remained below 70% in the past 3 years. As of November of 2022, in addition to the 16,600 that will still needs to be enrolled, there are 18,800 PHIV who were previously enrolled but got lost in care. Wala siya, no? And should be returned to treatment. There are several challenges in terms of treatment adherence, no? And in response to this, there had been several implementations in place as well. So, meron naman ng response nito si program para maibalik natin yung ating mga nawawala, no, na mga PHIV. Lastly, moving on the last gap, which is the third 95%, is the viral testing suppression. Data shows that viral suppression rate has been high in the past years. Viral load testing coverage has been below 40%, with only 1 in 4 tested for VL as of November 2022. This has been one of the main gaps that we continuously face every year and has been the lowest in our 95 95 targets. One of the main challenges faced in this gap is the lack of viral load testing, cartridges, and machines. No? But what's good to hear is that there are several strategies in place, such as yung TB-HIV collaboration for sharing of the gene experts machines, and also thanks to our development partners who are supporting us by providing the viral load cartridges. No? In terms of mortality, meron na po tayong reported deaths, no? A total of 6,200 among diagnosed HIV cases from 1984 to November of 2022. Looking into annual deaths shown on the bar graphs, no? The numbers had been increasing over the years. However, it should also be noted that several factors may be attributed to this increasing, no? Such as the increasing diagnosis, among which is 30% had clinical manifestation of advanced HIV. Infections are classified as AIDS, no, at the time of diagnosis. So strengthened mortality reporting, and that in early years, access life-saving treatment was still much lower compared to the recent years, no. Medyo nag-improve na yung ating reporting ng deaths, pero hindi pa rin siya ganong kaganda yung ating reporting ng deaths. Marami pa rin hindi nakakapag-report ng mortality sa amin dahil may mga pwedeng namatay sa bahay, no? Na hindi na report sa hospital. So may mga cases na ganon. Now that we have seen the trend of increasing cases in our country and the key behaviors and knowledge of our key populations, which contributes to the increasing epidemic, let us now take a look at our status naman of the 95 targets. With the goal of ending AIDS by 2030, the UNH established a 95 target for our PHIV, meaning 95% of the estimated PHIV must be diagnosed, and 95% of those who were diagnosed were enrolled, no, and should be alive and on ART. And finally, 95% of those alive and on treatment ay dapat virally suppressed. With the goal of ending AIDS by 2030, as mentioned, no, nakita ko na, the HIV care cascade is used to track progress towards 95. The pillars of the cascade include estimated number of PHIV diagnosed, diagnosed PHIV enrolled and retained on ART, tested for viral load, and virally suppressed among PHIV on ART. While the health sector plan is the Philippines Health Sector Plan, or the HSP, was developed and served as a strategic plan for health response in the country. The main goal of the HSP is to reverse the trend of the HIV epidemic by reducing the estimated annual new infections to less than 7,000 by 2022. This envisioned to be achieved by targeting high-risk populations and PHIV through the high-impact prevention, testing, treatment, and adherence strategies. For PHIV, the end goal is for them to be diagnosed, enrolled, and retained to treatment, and become virally suppressed, and live a normal, healthy life. On the other hand, for our key and vulnerable populations, the end goal is to prevent them from getting infected and retain negative status. The HIV Health Sector Plan aimed to enroll 10,000 MSM and transgender women on PrEP by 2022. Interim guidelines of implementation was released in January of 2021, and training on service provision and reporting followed on the Q1 of 2021. The phased rollout was done prioritizing high-burden category as cities or in country by October of 2022. So there were 66 sites na providing free PrEP across 7 regions. And at the end of the reporting period, meron na po tayong na-report na clients enrolled 11,100. No? As of November of 2022, 64% of the 158 estimated living with HIV know their status and have been diagnosed. Moving on to treatment coverage natin, meron tayong 65% of those diagnosed with HIV currently on ART. And of those 66,000 PHIV and ART, 25% nito ay virally suppressed or yeah, tested kasi is mababa, pero yung ating virally suppressed of the 66,000, mayroon tayo 97%. In terms of testing, diagnosis, and treatment, the health sector plan of 2020 to 2022 has included innovative and differentiated approaches for these services, which include but not limited to the diversified methods of testing. Example nito ay yung community and facility-based screening, self-screening, social and sexual network testing, intimate partner testing, provider-initiated counseling and testing. So treatment and adherence strategies also initiated the introduction of safer regimen, securing the ARV supplies, immediate linkage to treatment, improving facility process and treatment hubs, enhancing case management, scaling up of viral load testing coverage, establishment of one-stop shop from prevention, testing, treatment, and care, and addressing barriers to accessing the services. Example nito yung stigma and discrimination, service delivery problems, financial burden, no? Looking at the HIV care cascade, no, among estimated PHIV historically, there has been an observed increase in diagnosis and treatment coverage per year from 2017 to 2019, shown in this table, no? However, with the disruption of services due to the COVID-19 pandemic, which has also resulted in increased infections and estimated PHIV, the country's accomplishment towards the 95 targets was also affected, no? Diagnosis coverage decreased from 71%, no, in 2019 and 67% in 2020, 65% in 2021. And as of November of 2022, diagnosis coverage was still lower compared to previous years at 64%. On the other hand, the treatment coverage naman, no, was sustained at 61%, no, from 2019 to 2020, and has increased to 63% in 2021 and 65% as of November of 2022. Remember that if the same gaps and cycle continues, we only sustain our current prevention, reach coverage at 13%, and treatment coverage among PHIVs at 42%. We will see that by the end of 2022, there will be more than 23,000, no? Which nasan yan? 23,000. Ito, 22,000 new infections for the year, and continuously increased to more than 56,000 in 2030. Okay. Now, given that we have seen earlier how services are slowly starting to pick up and diagnosis treatment trends are slowly increasing, if we are able to somehow sustain our current prevention efforts and achieve projected increase in annual ART coverage based on our historical accomplishment, new infections by the end of 2022 is at 23,600. You may think it may be not that big of difference compared to baseline. However, looking into 2030, new infections will be reduced by 30,200. So ito po yun. Even more impactful, no, is if we're able to implement a successful and comprehensive health sector plan wherein the 95 targets is by the end of 2022, no, we'll see a reduction in annual new infections by 2/3, no, in 2022 from the 21,400 as the baseline. Asan yung 21,400 as the baseline? So now that yung ating November 2022, yung ating national accomplishment is only at 64, 65, and 97 with 25% viral load testing coverage, which is still way far from the health sector plan year-end target, no? However, we must not discourage and lose hope, but instead let us use this opportunity for us to intensify our efforts and fast-track our response. If we achieve the more flexible and new 95-95-95 by 2025 global HIV targets, no, we can see that annual new infections are projected to decrease and reduce by to around 7,700 by the end of 2030. Ito po siya. Okay, so how then we do move forward from here and towards the 95-95 targets and breaking the cycle of HIV transmission? Going back to the HIV prevention and treatment care cascade, again, we must ensure that key and vulnerable populations have access to preventive services and or practicing protective behavior. PLHIV are diagnosed and diagnosed PLHIV are on life-saving ARV. And address the leakages along the cascade. And lastly, that we address barriers to access to services and ensure an enabling environment for KP, PLHIV, and service providers. Addressing the existing gaps and challenges along the HIV prevention and care cascade will require intensified efforts, no? Policy development, implementation, service expansion, and innovation. Several innovations such as online outreach, pre-exposure prophylaxis, differentiated service delivery for testing and treatment had been implemented to ensure the continuity of services and that KP and PHIV will be able to access the services through various options. However, in order to successfully reverse the trend of HIV in the Philippines, all sectors should work together in implementing key interventions, not only in health service delivery, such as strengthening of PrEP implementation and other prevention strategies, scaling up of services, particularly boost in testing, diagnosis and treatment coverage, expansion of RIVDA and treatment facilities, improving strategies of retention to treatment, but as well as ensuring and strengthening an enabling environment for PHIV, key population and healthcare service providers such as collaborative effort will be key in protecting our key and vulnerable populations and PHIV community and in achieving our goal of ending AIDS in the country. So I think this is my last slide. So thank you so much for your attention. Over to you, Radnir.